So say you were going to wash your dishes and you wanted to wash dishes and you only were going to use a sponge and that's it, to just scrub the food around. That would be like flossing. But say you're like, okay, well now I want to remove all the food particles from the dishes. So then what would you do? You would rinse it with water. And that's where the water flosser would come in. You want to rinse between your teeth because you've scrubbed everything out, and now you're flushing it out. But then the third step is, okay, you want some sort of like antibacterial, clean. You want something that's going to actually help keep the dishes clean and get rid of any extra residue, any buildup. That's where the concentrated mouth rinse, when you add it to the water flosser, that's what that's doing. So it's acting like the soap. So if you were just going to wash your dishes with a sponge, do you think that's going to be as effective as if you were going to use a sponge, some water, and some soap?
And tell them how the cavities, most of the people get cavities between the teeth.
Yes.
What is the reason for that?
Well, there's a bacteria that is called Streptococcus mutans, if we're going to get really nerdy, but that bacteria gets stuck between the teeth and it eats the food that we eat, and then it digests it. And how you get a cavity is that bacteria releases acid as a byproduct. And if you don't clean between your teeth, you don't clean out that space, that bacteria is thriving off of all the food you eat and the food that's getting chopped up into tiny little particles and lodged between your teeth. So if we don't clean between the teeth, that bacteria is just having a field day and you're just feeding it more when you eat food, and then that's what ends up causing cavities. And a lot of the times, those are the ones you can't feel anything, you can't even see them until it's almost too late or you have a dental radiograph that shows something.
So basically the acid causes indentations in your enamel. These indentations ultimately start to grow, and you end up getting literal cavities that will go and puncture your enamel into your dentin. And once the enamel is punctured, you have to go to Krista's boss, get drilling and filling done.
Yes.
There's no, and billing.
Yes.
So there's no shortcuts then. So it's your time of the day to get into the regimen so that you don't have to go all that route. But again, don't forget, this does not mean that you don't go to the dental office and get a cleaning done from Krista.
Yes. Correct. You have to